I'm a nurse practitioner student, and today I will do an assessment on you. First, I'm going to wash my hand. Can you tell me your name and date of birth?
Melissa Wilson, 04/27/1991.
Okay, now I'm just going to inspect your skull, checking for the shape and the size of your skull. Is normal cephalic. I'm going to inspect your skull, checking for any scaling or lesions. No scaling or lesion noted. Now I'm just going to palpate your skull. Any pain?
Okay.
No mass, no tenderness noted. And now I'm just going to inspect your hair, checking for any hair loss, patches, and checking the color. No patches, no hair loss noted. Now I'm just going to inspect your face. It's symmetrical, no edema, no lesion, no scars. Now I'm just going to palpate your temporal artery. Any pain?
No pain.
Temporal artery is non-tender. I'm going to check your visual acuity. I want you to hold this 14 inches away from you and cover one eye. Read this last line.
LTFPH.
Same thing with the opposite eye.
LTFPH.
Okay, vision is 20/20. Now I'm just going to observe your eyebrow is evenly distributed. I'm going to check your eyelid, is no drooping noted. I'm just going to check your eye position, no gazing noted. I'm going to check your lateral and medial contours, symmetrical on both sides. I'm going to check your lacrimal system, no tearing, no dryness noted. Now I'm going to check your conjunctiva. Look up for me. I'm just going to pull on your eye. Great. Conjunctiva is pink, sclera is white, cornea is yellow, iris is brown. Now I'm just going to check your pupil size, which is equal in both, like a 3 millimeter on both sides. Now I'm just going to check direct and consensual light reflex. First I'm going to check direct. Just look at me. Good. Now I'm going to check consensual, looking at the opposite eye. Pupil is equal on both sides. Now I'm just going to check conventional. I'm going to look at my pen. I'm going to bring this closer to you. I just want you to follow the pen. Okay, and now I just want you to look at the door behind me and then look at my pen. Great, so pupil is equal, wrong, reactive, and to light and accommodation. Now I'm just going to check your extraocular movement. I want you to follow the pen, but not with your head. Great. Now I'm going to check your visual field. I want you to cover your right eye. Great. And I want you to tell me how many fingers I'm holding up.
2.
How many fingers I'm holding up. Now I want you to switch eye. How many fingers?
2.
Great. No nabiscus noted. Okay, now I'm going to do a fundoscope exam in your eye. I'm going to shine my fundoscope into your eye. Okay, now I'm going to check for your red light reflex, your optic disc, and your molecular. And I'm going to do it in the opposite eye. Great. No retinal hemorrhage noted. Macula is no yellow deposit noted, and retinal disc is red light reflex is noted in both eyes. Check your nose and your sinuses. I'm just gonna check your nares for patency, and I'm gonna ask you to smell this for me. What do you smell?
Lavender.
Great. Now I'm gonna palpate your nose. Let me know if you feel any pain.
No pain.
All right. No tenderness noted. Now I'm gonna inspect inside of your mucous membrane and your septum. Great. No deviation, no proliferation, no discharge, no polyps, and mucous membrane is pink. Now I'm going to palpate your frontal sinuses, and then I'm going to palpate your maxillary sinuses. Any pain?
No pain.
All right. No tenderness noted. I'm going to do a mouth examination on you. First, I'm going to inspect your lip. It's pink. It's moist. No swelling. No lesion. Do you mind opening up your mouth for me? I'm going to inspect your teeth. It's white and it's clean. Mucous membrane is pink, moist, no lesion noted. Could you stretch your tongue for me? It's midline, moist, pink, no lesion noted. Do you mind lifting up your tongue? It's pink, moist, and no lesion noted. A little up so I can see your palate, which is also pink, moist, no lesion noted. Say ah for me. Looking at the tonsils is +2 and uvula is midline. Ears assessment on you. First, I'm going to check your ocular just to make sure it's symmetrical inside and checking for tenderness and any nose. Now I'm going to do a whisper test. You just say what I just repeat what I say.
1 to 3. 1 to 3.
Great, you hear great in both ears. Now I'm going to do a Weber test. Just let me know if you hear the sound in both ears, middle ear or left or right.
Middle.
Okay, great. Now I'm going to do the Reynolds test. Let me know when you stop hearing it.
Stop hearing.
Let me know when you stop hearing it.
Stop hearing.
Great. Let me know when you stop hearing it.
Stop here.
Let me know when you stop hearing it.
Stop here.
Great, no lateralization, and air conduction is greater than bone conduction. Now I'm gonna palpate your mastoid process, any pain.
Okay.
Now I'm gonna palpate your tuscus, any pain.
Okay.
No tenderness and no mass in the mastoid process or tenderness. Now I'm gonna inspect the inner ears. I'm just inspecting the right ear, and I see the cornered light at 5 o'clock. I'm gonna inspect the left ear, pulling up and back. And I also see the cone of light at 7 o'clock. In both ears, there's no discharge, no redness or inflammation, no mass, no lesions. And the temporal membrane, no proliferation, no scarring. And the color is pearl gray. Okay, now I'm gonna do a chest exam on you. First, I'm gonna inspect your anterior and posterior diameter. And then I'm gonna inspect your lateral diameter, which is a 1 and 2. Now I'm just gonna inspect your chest for symmetrical, any bulging, any retraction, and then I'm also gonna inspect your back. Great. Respiration is 16. Now I'm gonna palpate your chest. Let me know if you feel any pain or tenderness.
Okay.
Great. Now I'm gonna do the same to your back. Let me know if you feel any pain or tenderness.
Okay.
Okay, no mass and no tenderness noted on palpation. Now I'm gonna do your chest expansion. I'm gonna tell you to take a deep breath. Take a deep breath for me. Great. My tongue expand equally in both sides. Now I'm gonna do tactile thermometers. I'm gonna, every time I touch you, I just want you to say 99.
99.
Great. Vibration field bilaterally in all fields. Now I am just gonna percuss your back. Okay, renaissance is here in all areas. Now after percussion, I want you to take a deep breath for me. In. Take a deep breath out. Okay, and I was just checking for diameter excoriation, which is 4 centimeters. Now I'm just gonna also take your back, checking all breath sounds. Honey, every time I touch you with the stethoscope, I just say E for me. E, 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 E. Okay, E sound is heard, so which means there's no consolidation. Now I'm gonna do the whisper pectoral test. I have you whisper 1, 2, 3 for me. Every time I touch you.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay. No 1, 2, 3 heard on auscultation, which means there's no consolidation. Could you lie down for me, please? Now I'm just gonna percuss the chest. Okay, renaissance sound heard in all field. Now I'm gonna auscultate the chest. Take a deep breath for me every time I touch you. Good. Bilateral clear sound heard in both lungs. You can sit back up.